Welcome to the channel. My name is Joel. Today, I'm going to talk about the respiratory system. Subscribe to the channel now for more information. The sections of this video are introduction, pulmonary ventilation, gas exchange, airway defense, trachea, and sneezing. Introduction. All body tissue depends on the efficient exchange of oxygen and carbon dioxide between the lungs and the blood. In order for the lungs to maintain adequate ventilation, the lung tissue and capacity must be healthy. Airways must be clear for air to flow freely, and the lungs and alveoli must be able to expand and contract. When these structures are performing properly, gas exchange between the alveoli and the capillaries can proceed across the respiratory membrane. By maintaining adequate ventilation or adjusting it to increase or decrease gas exchange, the respiratory system keeps oxygen and carbon dioxide at healthy levels in the blood and body tissues. Pulmonary ventilation. Pulmonary ventilation, or breathing, is induced by changes in the volume of the lungs and the air pressure within them. During normal inhalation, the diaphragm and external intercostal muscles contract, and the rib cage elevates. As the volume of the lungs increases, air pressure in the lungs drops below atmospheric pressure, and air rushes in. During normal exhalation, the muscles relax, the lungs become smaller, pressure inside them rises, and air is expelled. Boyle's law explains this relationship between volume and air pressure. An increase in the volume of a container lowers the pressure of the air inside. A decrease in the volume raises pressure in the reduced space. The body's demand for more oxygen can change normal breathing to forced breathing. Additional muscles increase the changes in volume of the thoracic cavity so that more air can pass in and out more rapidly. During normal inhalation, the diaphragm and external intercostal muscles contract, the rib cage elevates, and the chest wall and lungs expand. The increased lung volume causes intrapulmonary pressure to drop below atmospheric pressure, and air rushes in. During normal exhalation, the muscles relax and the lungs contract. The decreased volume increases intrapulmonary pressure, and air is expelled. Tidal volume is the amount of air that is exchanged during normal breathing. The body's demand for more oxygen can change normal breathing to forced breathing. Additional muscles increase the changes in the volume of the thoracic cavity, so more air can rapidly pass in and out. The additional amount of air, beyond normal breathing, is called reserve volume. Tidal and reserve volumes can be measured to determine vital capacity. Gas exchange. Gas exchange occurs in the lungs as oxygen and carbon dioxide diffuse across an extremely thin respiratory membrane. This membrane is formed by the alveolar epithelium, the capillary epithelium, and the interstitial area between the two. The exchange is driven and regulated by the partial pressures of oxygen and carbon dioxide in the air and blood. According to Dalton's law, the higher partial pressure of oxygen in the alveoli drives diffusion across the membrane into capillaries. Meanwhile, the higher pressure of carbon dioxide in the capillaries drives its diffusion into the alveoli. Normally, blood pressure in the alveolar capillaries is low, and there is a balance of hydrostatic and oncotic pressures on the fluids in the alveoli and in the capillaries. When the hydrostatic pressure is greater than oncotic pressure in the capillaries, fluids pass through the capillary wall into the alveolus. Hydrostatic and oncotic pressures must be balanced to prevent fluid from leaving the capillaries and flooding into the alveoli. Airway defense. Air that enters the nose is filtered, moistened, and warmed by structures in the respiratory mucosa. Coarse hairs filter out large dust particles. Cerumicous glands secrete antimicrobial substances and mucus that traps and moistens the air. Blood flowing through capillaries in the mucosa warms the air. The filtered, moistened, and warmed air then continues toward the trachea. The upper and lower respiratory airways warm, humidify, and filter air during inspiration. The lung tissue is protected by several defenses in the lower airway. Irritant receptors react to particles and toxins by triggering bronchospasm or bronchoconstriction. The airway's epithelia are lined with cilia and mucus-secreting cells. The mucus traps inhaled debris and cilia sweep it up into the pharynx to be coughed out or swallowed. Finally, if an antigen is detected, Airway cells secrete antibodies and other substances that start an immune response. These reactions cause the body to expel harmful substances by a defense mechanism, such as coughing. This is vital to the protection of the lungs and alveoli and to restoration of normal airflow. Trachea. The trachea conveys air between upper and lower respiratory structures. This flexible tube extends from the larynx to the upper chest, where it divides into the bronchi. Between 15 and 20 cartilaginous C-shaped rings keep the trachea from collapsing or overexpanding. The shape of these cartilaginous rings allows the trachea to change shape to accommodate masses of food passing through the esophagus. Smooth muscle of the trachea can contract to decrease its diameter, which allows air to be expelled out of the lungs more forcefully during coughing. The trachea divides into the bronchi and bronchioles in the lungs. Relaxation of smooth muscle in the bronchioles during exercise causes them to dilate. This bronchodilation allows greater ventilation. Allergic reactions and histamines cause the opposite effect, known as bronchoconstriction. Sneezing. Sneezing is an involuntary expiration of air to rid the nasal passages of foreign material. Particles that enter the nostrils and irritate nerve endings in the nasal mucosa trigger impulses that are transmitted via the fifth cranial nerve to the brain's sneezing center in the medulla. This sets off a respiratory response. Rapid inspiration fills the lungs, the epiglottis and vocal cords close, and the muscles of exhalation in the chest and abdomen tighten in a spasmodic contraction. These events create a buildup of pressure in the lungs. When a sufficiently high level of pressure is attained, the vocal cords relax, the epiglottis opens, and an expulsion of air rushes through the nose and mouth. The force of the sneeze propels the irritants out of the nasal cavity. Thank you. Don't forget to subscribe to the channel for new knowledge.